Hello, and welcome to the Spotlight section of the website of the Institute for the Advancement of Food and Nutrition Sciences, or IAFNS. My name is Neil Saab, and I'm Senior Science Program Manager here at IAFNS. In this presentation, I would like to highlight recent research sponsored by IAFNS on the dose-response relationships for peanut allergy in U.S. clinical trials. So why does this matter? It is estimated that peanut allergies affect approximately 4.6 million adults and at least 1.2 million kids and teens in the United States. Allergy management is hampered by ambiguous packaging declarations such as may contain. You may have gone to the store, picked up a box of cookies, and it says something like, this may contain nuts or may have processed in facilities that may have come in contact with the processes, other allergens such as nuts, milks, and so on and so forth. There is a need to better understand allergen doses that are likely to present unacceptable risks to people with allergies. This work that is funded by IAFNS supports development of harmonized approaches for developing more meaningful allergen labels. Just for some background, in 2016, the National Academies of Sciences recommended that industry, FDA, and the USDA work together to replace precautionary allergen labeling with a new risk-based labeling approach. And this formed the basis for this project. So this work presents the first analysis that we're aware of the relationship between the dose of peanut protein on one hand and allergic response in sensitive individuals in US clinical trials on the other hand. Now, identifying doses that do not pose an appreciable risk is a more powerful tool for consumer protection than existing labels such as may contain. So with that in mind, our goals were to first describe the distribution of individual response thresholds for use in development of eliciting doses for peanut protein. And it's worth at this point to spend some time talking about what eliciting doses are. So the population threshold is often described in terms of percentages. For example, eliciting dose of 0.1 or ED01 is the dose that is predicted to provoke a reaction, allergic reaction, in 1% of sensitive individuals with a specific food allergy, in this case, peanut protein. Now, this terminology of EDs, or eliciting doses, is useful for comparing the potency of one allergenic food versus another, and also in predicting how many individuals would develop a reaction to a specific exposure, such as a food contaminated with an undeclared allergen. This work was recently published in the journal Food and Chemical Toxicology, and you can see the reference here on your screen. Moreover, the publication is available for download for free on our website. And I would also stress that all of the research that is sponsored or funded by IAFNS is available for free via open access, and we have links to all those publications on this portal on our website. So by all means, feel free to take the time to peruse and download at will. So the key results from this study, the ED01 estimated to elicit an allergic response in 1% of sensitive individuals was calculated to be 0.052 milligrams of peanut protein. On the other hand, the ED05, which is estimated to cause a response in 5% of sensitive individuals, was calculated to be 0.49 milligrams of peanut protein. So how do these results compare to other studies of the same nature? Many of you who follow the literature are aware of VITAL, which stands for the Voluntary Incidental Trace Allergen Labeling Program. This is the program based in Australia and New Zealand, which is a voluntary program that evaluates eliciting doses and attempts to translate that into labels. VITAL reports an ED01 of 0.1 milligram and ED05 rather of 2.1 milligram protein based on thresholds for 1,306 individuals. There was also a recent study by Ramitong et al. that conducted an analogous study to ours using also a hierarchical Bayesian analysis. And they calculated an ED01 of 0.7 milligram peanut protein based on cumulative dose and 0.2 milligram protein based on discrete dose. Also, in previous work by one of the collaborating groups on our current paper, an ED05 of 0.49 was calculated based on cumulative dose. So it is not uncommon to see a divergence in results like this. Keep in mind these were studies conducted in different geographies. In some cases, we have populations in the US versus Europe versus elsewhere, different methodologies, different investigators. The challenge going forward, however, is how do we interpret all these results and how do we use that cloud of variability to our advantage to better anticipate the response of populations in general. And if you would like to read a discussion of all of these results and some suggestions of what the differences may be caused by, I invite you to read that in the discussion section of the publication. So what are the next steps in research? It is clear that we need more research to understand response to peanut allergens among various population subgroups. We are often asked, how does the ED response vary between, let's say, white and Hispanics, children and teens? And the answer is we need more data. We need to have more studies on larger population numbers so we can address those questions. There's also need to extend this work to other food allergens. Peanut allergies being so common and affecting children to a large extent, there's a lot of data there, but there's not quite as much data on the other allergens. So there's a need for sure to conduct research in those areas. And there's also a need to understand and to develop methodologies for interpreting all those ED values and being able to morph those into more informative allergen labels that can better educate consumers and reduce the risk of exposure to potentially harmful allergens. Last but not least, collaborations. We at IAFNS use collaborations as our middle name. We work collaboratively with our partners and stakeholders in the food industry, government scientists and regulators, and also academic researchers to collectively identify solutions to questions like these. And in the next few weeks and months, you will see us putting together roundtable discussions of experts to begin to address the questions of where do we go from here, what the next steps are to move this information to the realm of making it useful to consumers. So with that, I would like to close by sharing with you some high-level points about IAFNS and how we work. I also invite you to take the time to look at our website. There's a lot of information there, a lot of committees and research that is being featured. And if you have any questions on this work or any of the other work that's featured, by all means, feel free to reach out to us. Thank you and have a good day.